Hello, everybody. Thanks for joining today's talk. Um, we're going to continue with the talk on mental health support, and today I will be focusing on treatment and recovery. So, for a quick recap on what we have talked about and what we've been talking about for the last few sessions or for the last few talks. Um, just wanted to touch base on um, the announcements and and um, and then I'll be talking more about the topic for today. So the announcement is that the registration for social anxiety group has started, and we would like to invite everybody to register. If you or someone who is going through difficulties with social anxiety or has any kind of social anxiety, you can register at relationary.com/register, and they will announce the start of this program or this group soon after that. The idea behind this, it can be for those who are currently suffering from or currently experiencing social anxiety, or it could be for someone who would like to know more about social anxiety and want to learn more on how to work with um, uh, friends or family to be a support for someone who has or is going through social anxiety symptoms. So the the date, so it's going to be on Wednesdays. It'll be 6 weeks, and it'll be at Relationary, which is in Sunway Geo, Sunway Bandar Sunway, and it's for ages of 18 to 30 years old. I think we can be flexible with that. If you want to join, you can always send us a message at clinical@relationary.com, or you can call 014-718-8213. The fees will be 50 ringgit for initial interview screening, and that would be a 75-minute screening interview session. And then there's a group, there'll be a group for 6 people. It's 300. That's for 90 minutes for each session. So if you're a group, you will have more time. Okay, so the therapists who are going to, or the clinicians who are going to be administrating or hosting this social anxiety group therapy, it'll be Ms. Huasian and Ms. Camelia. Both will be collaborating and working with that. Both of them are interns at Relationary, and this is their program, and looking forward to helping you all with your needs in relation to in relation to um, um, social anxiety. So we're gonna go ahead and start the. Yep, have a seat. We're recording live, so just to inform you folks. So today's introduction is going to be a quick review for what we spoke about before, and to illustrate and emphasize that the content of this program has been developed based on clinical-based evidence that is coming from evaluation studies and randomized controlled trials. This content will help people improve their knowledge of people with mental illness, reduces their view of them as a stigma. It raises the level of primary assistance to patients with psychological condition in the community. So this content, this information is designed for general public, and it's not that you will be, excuse me, that you will be a therapist or a counselor by learning this. This is only to help you understand how to be a supportive person into someone's or with someone who is going through some kind of mental illness or some kind of mental health condition. Okay, so the skills that you will gain from these talks is reflective listening, active listening, intervention, which is an intervention is about focusing mainly on support, and also initial psychological assistance. So that's going to be the focus of these talks that we will be spreading throughout. And these talks, just to also remind everybody, these are talks that are happening on bi-weekly, every other Sunday at 11 a.m. So you are always welcome to tune in to join our broadcast. So we covered all these items that are dimmed in gray, and today we're going to talk about recovery. So I thought recovery is a really important topic, so I dedicated all of today's talk about recovery. And I also will be talking more on treatment and recovery in general. So, so just to go over a few concepts that we established before, the supportive and the supportive role is that you will be focusing on to be a supportive person to someone with mental conditions. Is to be helping the person to prevent or to become aware yourself or those who are around you, colleagues, loved ones, and friends. So you'll be more aware on how to help them prevent it and how to be more aware of the causes and how things happen. Also, the supportive role or the supportive services that you will be providing to your loved ones, it will help them to take early interventions into their symptoms and their conditions that they're going through. Also, it will help you will be also a key helper or key support to those people around you who are going through some kind of mental conditions, is to guide them through the treatment that is needed and to continually support them and throughout their treatment journey. So, with that said, today's topic is focusing on treatment and recovery. So recovery indicates that the patient overcame the challenges of their illnesses during their lifetime. So that's in general, that's a general description of a recovery. However, it's not always that means that the illness is gone. It doesn't mean the illness disappeared. However, they were able to overcome the challenges of their illness, and I will explain that more shortly. It is more than just achieving the absence of symptoms. So the symptoms might not disappear, but they're still able to overcome the challenges that come along with that illness. So one can describe recovery as the way to live a fulfilling life filled with hope and has an active role in society, even with the presence of the illness or its effects. So when the illness, I mean, even if we were to say that in many cases the illness is gone, however, the effects of the illness is still there. In many cases that are not, but there are. So it's not a condition that if the effects are not there, that means the recovery has not been achieved. And that's really interesting concept that we all need to understand, because of some of the feedback we're getting from some clients or some people who have not experienced or went through the discovery of mental illness, or they've never had any mental conditions, but someone they cared about who had mental condition, and they are saying, when are they going to be cured? When are they going to be fully recovered? And the answer to that is that sometimes may not be fully recovered. They might not fully recovered. However, they will be able to recover or to overcome the challenges that come along with the illness of such cases. So I will elaborate more on that, and I will discuss more on that, but this is just an introduction for today's talk. So two more points that for the introduction is that when we talk about recovery, it will include a new meaning and purpose in the lives of the people after overcoming the severity phase, or the catastrophic phase, if you want to call it, with their psychological disorder, or the psychological condition that they are going through. So, meaning that throughout the therapy, throughout the treatment, they will achieve a new meaning to their life, a new purpose in their life, and that can only be achieved after or during the last phase of overcoming the severe phase, the catastrophic phase, the most difficult phase so would be dropping from severe to moderate, for example, or from severe will drop to mild. So in that transition, there will be a new meaning and a new purpose for someone's life. Um, so why is this important to understand? Is that because it's not the therapist really to make that meaning for the person. Is that person need to develop that new meaning and a new purpose for themselves. So the therapist doesn't have a magic wand or a switch that can make this happen. So that means that the treatment, until it reaches to this level, it can take many sessions and it can take many months until this occurs. And I will explain more why it takes that long and why does it really require that smooth transition throughout the treatment. So the therapist is invested into the relationship with the client, right, with the patient, with the mental condition. So the therapist is if the therapist had a client who has anger, for example. So I just want to pause here for a second. I attended a talk the other day, and the speaker was talking about mental illness, and I hear myself saying the same thing. But it's really important for us to understand what is mental illness, what is a mental health condition. It's not something that some people, they stigmatize mental illness to be. Mental health related conditions can be anger, it can be frustration, can be disconnection from a relationship, being isolated by other people, closing their door and staying in their rooms for a long time, and the family is wondering where they are. All these behaviors indicate that there is some kind of, or there's a possibility of some kind of mental health condition with that person. Someone has a change in their spending behavior. They're really buying more things, or maybe they're not interested to buy things, and they never bought a shirt for the last 5 years, for example. These things are another indication of there's some kind of there's a possibility of some kind of mental health condition. There's a change in appetite. They eat more, or they eat less, or they drink more juice, or they change the types of drinks, or they start smoking, or they stop smoking, or so any of these major changes, they can be related to a mental health condition. Also, the amount of patience one can exert and express, if that changes, if someone is not as patient as they used to be, or someone is more quiet more than they used to be, all these are also indications of some kind of mental health conditions. So when the patient, when there's someone with mental health condition coming to the therapist, that means the therapist is invested into this patient. However, there has to be an understanding that the treatment will be most effective when the pillars of recovery understood, that people need to have the desire and need to have the hope that they will recover. and they need to prepare for it. So, and when they prepare for it, that also allows them to have a new mindset that would enable them to work hard for it, and and the and that is true for the patient and for the helper or the therapist. So, so from a support perspective, a person can support another person to seek the right help, or to be aware of their symptoms and so forth. Is that the other person needs to be aware that they need to have a desire to be better. They need to they need to prepare themselves to reach out for help. They need to work hard in order for them to reach out for help. See, for example, if somebody worries a lot or has some kind of anxiety, like I mentioned earlier, we have this group therapy for social anxiety. So someone who has social anxiety, it feels more comfortable for them to stay away from people or stay away at home and play games or watch videos, or just maybe just lie down on the bed. So if they really want to, so if that someone wants to seek help, that means they need to get out. Now, getting out for them is not something that is pleasant. They don't like to be around social settings, and they don't want to come maybe have have a little chat about themselves to some stranger. Now, the challenge with that is that that's the part that they need to invest in themselves, and that's what the helper is really need to focus with, on when working with these cases with these people, is that they need to encourage them to invest in themselves, and this is effort that is well done and is well paid off, and the value of these kind of efforts and hard work will pay off. So it will not just happen, it will not just disappear. Somebody has to do the effort, and the best person to do that is the person who is experiencing some kind of mental health condition. So so I mentioned a little bit about mental health conditions, and also there are examples of mental health conditions relating to paying attention. Someone who at school, or not able to focus on a question in a quiz, or some, or a parent telling the child to do something and the child does the opposite, or doesn't do it fully, or doesn't do it at all. These are attention related mental illnesses or mental conditions that need to have an intervention by a therapist. Sleep problems is another mental illness or mental condition that need to be addressed by a therapist. Sleep problems here, that can mean increase in sleep or reduction of sleep. So when someone does not sleep as long, or hasn't slept for a day or two, or only slept for a couple of hours for the last week or so, that needs to be attended by a professional. And vice versa, if someone's sleeping long days or long hours in every day, so that would require for him to or her to be assessed by a clinical psychologist to see what could be how severe is the problem, and then they will be able to address and focus on the treatment, and they would propose treatment accordingly. Another example for mental illness or mental health conditions is the substance use or substance abuse. The substance use can be related to alcohol, can be related to drugs, and also can be related to any unhealthy, excuse me, or any unhealthy behavior. That can be behavior of like smoking, or vaping, or like watching pornography, gaming, all these things that can be related to being addicted, or not addicted, but maybe dependent on certain activity or certain behavior. So these are also related to mental health conditions. Someone who is, for example, driving recklessly, that can be related to a mental health condition. Someone who is um, treating people harshly, or um, demanding things for people, who has no empathy or no emotions towards people, that can be also mental health related condition. There are quite a few that someone who is not able to keep a job, for example, continuously changing jobs. That's another sign for some kind of mental health condition related case. Last talk we had was in relationship to Adam. Adam was the case study that we talked about last time, and he had any successful man's dream. Basically, he had a life of any successful man's dream, but he just wanted to walk away from it all, and he just wanted to have a new start, new everything. So that is another example. That's a classical example of mental health condition related cases. Also, there's some kind of personality behaviors in regards to people. We hear about some type of different type of personality disorders that also is related to mental health conditions. I gave a talk about relationships and toxic relationships, and he explained, if there is, signs and symptoms of a toxic relationship, and the toxic relationship, and the person who is inducing the toxicity in the relationship, is very likely they are likely to have experienced or experiencing some kind of mental condition or mental health condition in that sense. Okay, so when we talk about the treatment and recovery, in many people, when you ask them about what psychology is all about, is they tell you about the brain. The head needs, somebody's messed up in the head. You ask someone else, they tell you no, it's the head and the emotion. People are not emotionally stable, so they need to be fixed. Well, if you dig even deeper, it could be some people's like, oh, their spirituality is not correct. Their mind is not correct. There is no balance between their mind and their spirituality, or their heart and their spirituality. Somebody will say, like, no, it's a whole bunch of things. It's the emotional part, it's the spiritual part, it's the cognitive part. All these things need to be, they're not imbalanced, and that person is suffering from all these areas. Well, it can be also including environmental aspects that is causing someone to feel mentally or to experience a mental condition, a mental health condition. Or it could be a physical, an illness, someone who has an illness that can cause the person to have some kind of mental health condition that would impact their satisfaction in life and their happiness and their view of themselves, and how to have the meaning of the life that they have. If it can also be part of the developmental, the childhood, the development part. When they were developed as a child, they did not have a complete chance to develop all aspects in their lives. For example, we see people celebrate birthdays. Some so and so, like, birthday is, they're 22 years old, or 25, or 35, or 48, but that's the physical age. Now, what's the emotional intelligence there? How old is that? So because you find someone who's 35 but acting like a 5-year-old, so that means that person is not a bad person, is not a childish person. That person may have gone through a developmental stages that prevented him or her to develop that kind of emotional or social intelligence. So because we have a social intelligence, we have a social age, we have an emotional age, we have a physical age, we have a spiritual age, we have a cognitive age. So all these ages, in addition to the physical age. So when you celebrate your 35-year-old, holiday, birthday. So what is your birthday from a social perspective? What is your birthday from a physical? A cognitive perspective. and so forth, and so on and so forth, or spiritual connection to the Lord or to God or to whomever high supreme power that you believe in. What is, your age in relation to the emotions? How comfortable are you to um, to manage your emotions when they're triggered? How flexible are you with that? And just so this is kind of what it means by developmentalized. So when it comes down to mental health conditions and treatments, it can cover all of the things that I mentioned. It could be cognitive, spiritual, environmental, emotional, physical, and developmental. Well, guess what? There's also social. So the social aspect is that, I don't know if you guys saw the movie called Joker. It's a really interesting movie for psychology. I don't recommend you see it. I mean, it's not really the friendliest movie, but from a psychological point of view, it's really interesting for us to watch that. And it shows how the impact of the society on that person, and how his inability to manage that kind of scenario and that kind of environment, it kind of tipped him off to be more on psychotic side. So the social aspect has also its own um, challenges and need to be addressed. Another example for social, it could be like bullying. Children or adults who were bullied at younger age, it really impacts their life in adulthood. And that's really something that we see very common, and it's quite natural. It's just that needs to be addressed, and it needs to be treated, and so on and so forth. So someone who was, for example, someone who is experiencing social anxiety, is it was it caused by the developmental phases that were not complete? Was it caused because of some social activity? Was it caused because of some physical appearance? It could be related to self-esteem, and could be also environmental, that the people around them are telling them things that they're starting to believe, and so on and so forth. Um, so another thing that can impact a person's mental health condition, or can cause a mental health condition, is something related to recreational. Recreational is to have a hobby, to have something, to have fun with it. So that's really important, that we can, I mean, or some just have some time to just stare at, beauty and look at things. I gave a talk the other day. I was asking people. I said, how many people eat dal? And everybody, of course, raised their hands. It's like, how many times have you raised up the plate and smelled it? So that smell, I mean, that taking that is really enjoying the moment and being present in the moment, that you are mindful of the smell of dal and how does it smell. Is mixed with, being mindful of that smell, and what is it mixed with? Is it the lentil? Is it the spices? Is it the curry they put in? Or you can smell all that, and just being mindful of that, that can be a mind-blowing experience. And I've done some, actually, a couple of incidences that I gave mindfulness class on how to activate the ability for us to be mindful in what we do. And it was quite an interesting outcome and feedback. And there are many more. Can you think of anything else? You can post it on on the comments, or you can share with me in private as well. So all of these aspects are in relationship to treatment, and in relationship to um, uh, that would help the therapist to understand where things are coming from. So from a helper standpoint, or the support standpoint, why this is important, it's really important for them to keep that in mind, not to act on it, not to tell the person, you know what, maybe your childhood was troubled, maybe that's why we don't want to do that as support. As a person who is providing, mental health support, we don't want to say any of this stuff. We just want to keep that in mind, because that would help us really to be sensitive in what we say. If we say to them, like, for example, and another thing is, like, we can add here relational. I mean, relationship causes that can cause. I mean, could be social, but in relationship more familial, related to the family. So if you were to talk to someone It's like, let's talk to your dad, let's talk to your mom. It's like, no, 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 no. So that tells us that it's really not about they don't want to get help. It's maybe they just don't want to get help from mom or dad or brother or sister or so on, because maybe there's something there that is causing it. So we just need to be mindful of when we hear the response of the one that we are helping, we need to be empathetic and be connecting with them and respecting their point of view of things and what they want and what they like. Because remember what I said earlier is that they need to have that desire to be better. We cannot make them get better. We cannot change their aspect in life or their desire to increase or decrease. We just want to be there for them and just hoping that your support is going to help them feel and make them feel safe so they can take the next step. And that's what it's all about. So from a helper point of view, it's good to keep that in mind, because we don't want to tell a person, you know, you're not close to God, that's why you're going through this. You need to go pray, or you need to do this, or you need to do that. That can really be the last thing, or maybe the last thing you say to that person and will ever see you again, because he or she might just kind of like be nice to you, but they will never listen to you again. They just shut you off. Or you can tell them, or you're not thinking straight, from a cognitive perspective. Why would you think that way? That's not how you connect with someone who needs help, to criticize them. It's like, oh, you're being too emotional, you're being too soft. And we hear this a lot. I mean, I'm not bringing this out of from vacant, uh, but um, but it actually happens a lot, and a lot of people lose that connection with their loved ones, and they just don't know what happened. They don't understand how come this person is no longer connecting or no longer communicating, but actually it's because it's something they said. Um, so someone would say, "Oh, I have a problem." I mean, they would have the courage, first of all, to say that I have a problem. That by itself is taking a whole lot of courage from them to come out and say, I have a problem. So when they come to you telling you that, it's like, oh, what did you do? Well, I mean, that's going to be like on the defensive. They're like, oh, what did I just do? I just talked to the wrong person. And they would probably pull out, like, no, no, it's not a big deal. And they would just change the whole subject. But if you were to say, something like, because in the beginning of this relationship as a support to your someone, to the person that you're helping, it's really important not to be judgmental. It's really important to connect from a humanistic point of view, not from a right or wrong point of view. Just assuring them and telling them, let them know that you are there to help, and that you're glad that they reached out to you to ask for help. And that must have taken a lot of courage from you to come out and ask for help. These three statements, if you see any of them, if you say any of them, excuse me, if you say any of them, you're connected, and that person would feel comfortable to tell you the next thing. This is true for parents towards children. This is true for children amongst themselves. This is true with parents amongst themselves, with spouses, married couples or not. It's really, really important to make that connection, to help them feel that you are there to support, you're not there to judge, and they need to seek help. So the treatment and the correction the correction comes from the treatment. So therefore, um, the correction cannot happen from a couple of words that you would say when somebody reach out to you and ask for help. So that can be very detrimental on how the relationship will continue between you and the person you are helping. so so someone, for example, would say that I'm fat, and they would come to you as like, oh, I don't feel comfortable going to this gathering. I'm fat. I really know people look at me really weird. So the natural thing, or many people, the common thing what people say is like, you're not fat. You look gorgeous. You look beautiful. Who cares about how you look? You're a wonderful personality, this or that. But the fact that they said that, I mean, it's good to say that if they're not going through some kind of mental health condition, because that openness or opening to you that they are fat, they are really trusting you that you will be there to support them. But telling them that there's something that they do not believe, you're not connected at the same level with them. So in a sense that they see themselves as that and they're not going, they're just letting you know that they're not going because of that reason. So by telling them, no, 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 you're not fat, you should go, you're not there with them. You're not at their level. You are really now telling them what to do. And you don't want to do that. So if you want to do that, that can come later, like maybe 10, 15 minutes, 20 minutes later in the talk. But it cannot be, I mean, saying it for the first thing, it can be kind of uncomfortable. And the person might end up going, but they're deep inside, they're still, maybe they're just anxious or not able to feel comfortable or enjoy themselves being in that gathering. So, so that kind of example is really to kind of reflect on the perspective. Even though the person may be not fat, maybe the person is normal or fair, or not fair, but normal shape or thin even. But if they see themselves fat, that that's an indication that they really need help, from a different kind of help, not just a kind of like convince them to go kind of help. No, it's a different kind of help that it's self-image related. So that's different type of different things. I mean, the things we would say for someone who needs, from us, from our point, to support them, is really to see it from their way, is that it's fine. It's okay if you don't want to go, and you wouldn't say, yeah, you're fat, but you would say it's okay if it's okay that if you don't want to go. So that would be accepting their decision, and that means a lot to them, the other person that is telling you that. So to them that is more important than you convincing them that they're pretty and they're not fat. So accepting their decision, especially if there were children with parents as well. So many parents will tend to think that the children don't know what they're saying, don't know what they're talking about, and that the parents know everything, and therefore the child needs to know it now. And that's really can be a huge disconnect between parents and children. So being mindful of the child's perspective of the situation is very, very important, and connecting with your child at that level can go for a lifetime connection. Another thing that can happen is in relationship to environmental challenges. Someone who is maybe in a toxic environment at work, or in a toxic relationship in the marriage, or has a toxic relationship with the parents, or toxic relationship with the siblings, or in school, or it could be any kind of toxic relationship. And they would speak up. And actually, pretty much all of what I mentioned, all the examples I mentioned, some people, they tend to, generally speaking, again, people tend to either tell people what to do, or they exaggerate the response. So like, oh, let's call this person, let's call that person, let's do this and let's do that, and they just kind of basically that make the other, the person who is going through the challenge feel apprehensive to do anything, and they just pull out and pull back, and they just never move forward. So we need to be like, for example, if a child was a bully, for example, he was or she was the bully in school. So you'll find that you'd find maybe the teachers, or the people, the administration at school, they would make a huge deal about it. That they would call the parents, like, you need to fix your child, and they would just, make the child who is a bully as a criminal. But that's an extreme way to look at it. So we're not saying bullying is acceptable. It's just that helping a person who is a bully it has its own tactic, and it has its own ways to address it. Like, for example, how would you know someone is a bully? That you would get some students complain about this person, and that person is bullying me this, bullying me that. And if that repeated, then what something needs to be done um, with that child or with that student. So it doesn't have to really repeat for so many times. It's just that there's some kind of a proper response to how to react to this kind of situations. But in general, what some people do is that they would take that child and they would reprimand them, and or they would scream at them and keep telling them, do not do this, you cannot do this to people, and all that. That kind of backfires. So they overreact to the situation and they try to fix it themselves, and that doesn't work almost all the time. Or they bring the child's parents and they talk to them and they expect things to happen, and many of the days or many of the times that the child parents don't even understand what the parent what the teachers are talking about. But then when you investigate and you really dig deep and see what's happening, is that this child was bullied emotionally by those children, and he was reacting or she was reacting physically against that. So it's really, so he cannot say, oh, they were calling me names or make me feel embarrassed. He just maybe felt shy about it, and he just went off and challenged them physically, and everybody would focus on the physical behavior, and they ignore the kind of emotional behavior that caused it all. So it's really important to understand the environment, and that's not something that we can assume right off the bat on what's happening. And our job as helpers is not really to figure out what causes it, because that happens from a professional point of view. They would need to visit these areas very carefully, because it can trigger stronger emotions inside them on what could be happening within themselves. Um, Self-harm and suicide is another thing that people suffer from, and suicide, either ideation or planning or actually attempting. So responding to these kind of cases is also needs to be sensitively addressed and empathetically dealt with, without any judging them whether they're spiritually weak or quote unquote, or they're not thinking it right, or they're in the wrong environment. So people tend to give them solutions, but that's not what they want at that moment. So if they're seeking for help, and as I mentioned earlier, that they need to have the desire and hope. So they may need the desire, but they do not have the hope. So as a helper, we need to give them that hope that it is doable, it's fixable, just hang in there. And being there, telling them these comforting words is really, really important for them to move forward in their lives. So, and there is also a different response to that. We'll get into details more and more topics or more talks in the future. But today I just wanted to focus on, generally speaking, the treatment and recovery journey. So, regardless of any of these aspects that could cause mental health, excuse me, mental health conditions, um, the treatment itself is quite a journey. Um, Clients or patients can be motivated and have the desire in the beginning. However, as they move forward, they may lose that desire, because the journey can be a bit of a challenge for them, because we mentioned about hard work. So that hard work, if it was not managed well by the therapist, that can be an overwhelming activity for the patient. So that would make the patient say, that's too hard, I'm not going to do it, and they just walk away. And so if this is a child, then the parents would think, oh, therapy is not working, doesn't work. But it's not just that, it's a lot of things that could be causing the therapy not to continue. So in this case that I mentioned earlier, is that the therapist really doesn't know the best way on how to go with the patient. So they would try one thing, and if that didn't work, the patient might stop. But it's really important to understand that if that didn't work, there are other means to do the same journey, but different tactics. So the support, the mental health support, would need to put this in the person's mind to help them understand that this is not like a switch that we all know which switch to turn on, and then they'll disappear. Because we can, therapy, we can work with emotions, we can work with cognition, we can work with memory. We can talk about the past and untangle it and get a new meaning of the past, or we can talk about the future and not touch on the past as much. But that's all depends on the resiliency of the patient and their ability to handle visiting, uncomfortable memories or traumatizing memories in the past. So the treatment journey itself can be an interesting discovery for both, for the therapist and for the patient. So going through that is something that needs to be managed with openness. So the patient needs to feel comfortable and open to talk to the therapist. um, I don't feel comfortable to continue this. I don't like this way to do this. Is there any other way to do it? So it's always important for the patient to ask these kind of questions. So the support would help the patient in case if the patient didn't mention this to the therapist. So if the support asks the friend or the family member, so how was therapy this week? And they say, oh, I didn't go, I stopped it. It's like, oh, what happened? So we don't tell them again, we don't tell them what to do. It's like, oh, you should go and all that. No, it's really important to understand what is it that they're going through. So they may open this. It's like, okay, I really appreciate you sharing this, and on so on and so forth. How about we talk to the therapist and inform them about what you are going through? Because this is really important. So the therapist would need to change their tactic, or maybe they are not qualified to do a different tactic. For example, there are modalities in therapy that maybe, like we can call it person-centered therapy, PCT, or it can be emotional therapy, EFT, which is emotional focus therapy, or it could be CBT, cognitive behavior therapy. So if you work with someone from a CBT perspective, it requires a lot of brain activities. It would require a lot of brain work. So that can be very difficult for someone with depression. That can be someone, I mean, not with all people with depression, but someone with depression. It can be difficult also for someone with anxiety. It can be difficult with someone with any of the symptoms or the conditions, the mental health conditions related to that person, what they're going through. And that difficulty is not because um, um, the wrong choice of the therapist. Is that we still, I mean, at the early stage, we don't know what would work best for the client. Even though we were to ask, it was like, would you like this kind of, but they really don't. They cannot really be a good indicator for themselves or for the client, because they also haven't gone through that process themselves. So, I've had some clients who knew exactly what they're looking for, and they told me, it only works with me for CBT because they had therapy before. So I worked with them with CBT, and they moved forward. They were able to move forward and achieve the goal that they came to see me for. So CBT is not for everybody. EFT is not for everybody. But for the therapist, they need to start somewhere. So they start with some kind of activities, and if it's difficult for the client stops to come. The therapist doesn't know what happened, and the client is still with the symptoms or with the condition. So that now the key role of the person with mental health support is really to be mindful of that kind of relationship between the therapist and the patient, to be also to continue to support the patient, to tell them, okay, maybe this guy is not, maybe not a good match for you. How about we try a different person? Because it's you being there supporting your loved one, or your relative, or whomever, or a friend, or even a colleague. It's really important that you will be the person who will continue with with this person to seek another help, and it doesn't have to be the same person, and that doesn't have to be the same therapist. So so that's something that is really important to keep in mind, and just to highlight the key role of the mental health support, that they can be the point of contact with this person to encourage them and help them through their treatment journey. So, how long? Very common question about treatment. How long does it take? Almost every client comes and I see that before we start, it's like, how many sessions? The answer is really we don't know, and there is really no set answer. I mean, there are processes that we do. The processes are known to cover, for example, 2 days, 3 days. I mean, sorry, 2 sessions, 3 sessions, 6 sessions. It depends on the process, and that's in an ideal situation. So if I were to work with a process with someone who is, who may be triggered through this process, we need to handle the trigger before we continue with the process. Triggered, I'm here talking either triggered by memory that is traumatic, or an emotion or some kind of experience that they've experienced in the past that kind of brought it back to life, and they reacted to that. So the duration of the treatment is not something that we can predict ahead of time. However, we have a general idea that it might take minimum 10 sessions, maximum is open. But really, it's really not realistic to expect any signs of change, any signs of improvements before 10 sessions. And that's quite normal throughout. If it's a relationship matter, if it's improving relationship, you're looking minimum 15 to 20 to start feeling there's a change. But again, it all depends on their desire and commitment to get better and to fulfill the treatment, to achieve that treatment. So so that's why it's really not easy to predict. It's not something that we can say for clearly that it's going to take this amount of hours or this amount of sessions. However, it is something that I had a couple that we had a breakthrough after 32 sessions. Yeah, and it was beautiful. After that, we had 2 sessions and we closed and it was done. So 34 sessions for the whole thing. So it took that much time to untangle a lot of things from the past individually and as a couple, from the family, from the system, from the environment, and it took a whole lot. But for them, it was every session was a new experience, was a new discovery, and they learned a lot about themselves and actually got themselves got together even closer than ever before. So another thing that can, I mentioned earlier about the client might not feel well or doesn't like a certain session and they stop. So I would like to mention something about counseling or psychotherapy. It is just like as if you had a wound and you went to see a doctor. Or if you, for example, if you know someone or you heard someone or you saw someone who I don't know, kind of had twisted their ankle or twisted their knee or something like that, and to fix it is a painful experience. It's not a comfortable experience. So treatment and healing in general can be painful, but it's not a bad pain. It's pain for the healing. It's really important to be mindful of that because it's physical healing is the same thing. If you like, I don't know if you saw someone who popped their shoulder, was dislocated their shoulder. Putting back the shoulder, it's a painful thing, but it has to happen for the shoulder to be better. Someone's teeth, need a cavity or something. Leaving it there is going to be painful. Well, curing it is also going to be painful. After the anesthesia is gone, there's going to be pain in the tooth or something around the gum that would also cause some kind of discomfort to go through as part of the treatment. Mental health treatment is no different. It can be experiencing some pain during the treatment, but this is a healing pain, or we can call it growing pain, because we are growing that part of our lives that we haven't developed maybe in the past and so forth. So that growing pain is just no different than if we were to, for example, go to a gym and work out or play a sport for the first time. You go to a home, it's like, oh, it feels great. When you wake up in the morning, you find some sore muscles that you never thought that these muscles existed in your body, but they feel like so sore you couldn't even move it. I was like, what did I do? These muscles, I never felt them before. Well, that's growing pain. The muscles are getting tougher, they're getting stronger. That's growing pain. And that's going through therapy, getting tougher and getting growth in your emotional intelligence and your social intelligence and all that would require some kind of discoveries. These discoveries can be painful for us to handle. But coming to the session and talking about these painful discoveries is essential for the treatment, is essential for the continuation of the treatment. Okay? So I'm going to end after this. So another reason why we talk about duration of treatment that takes a long time, so I strongly believe therapy, psychotherapy works 100%. It just takes a long time. It takes a long time because we are working with the brain itself. So this is a picture that I got it from this research on neuroscience and psychology. This is a brain scan of a depressed brain, and this is a recovered brain. So the blue dots or the purple dots or even the black dots these are the least active parts of the brain, and the ones that are brighter colors, they're the more active parts of the brain. So therapy works because we are making connections, physical connections in the brain, and that takes time. So this is naturally done at a younger age when things are still developed, and that does happen automatically. But when we are at an older age, we need to disconnect bad beliefs, bad connections, and make new connections. That process can take a long time. I have clients also 60 sessions, and they're still benefiting from it because it's a slow process for them. I cannot expect them to be the same as someone else who is maybe a bit more developed, if that's the right term, for the lack of a better word, maybe more developed, but more developed in that part of the brain. But if this one here, I would say if someone has so this one on the left has a little bit of couple of yellow color dots there, but if they were black, then the black one means it's a really less developed part. So this is more developed, and you would see on the right was able to develop it maybe faster than someone who would be at this level is purple or black. It would take a longer time. So it's not about really that they're not developed in a sense that they're disabled or has some kind of handicap. No, it's actually is a matter of really just like a muscle that we never used before. So it's not developed. It's not something that we did wrong. It's just that we never used it before. No one ever told us that you need to use this muscle. So as we grow adults, we need to use this muscle, but we don't know how to use it. And that's what therapy really does. It really helps us to learn how to use that part of the brain and make the connection properly and accurately. And this is one of the reasons why it takes a long time for the brain to make these new connections and to be active to manage depression or anxiety or anger or any functioning dysfunctioning relationship, or even overthinking. Overthinking also can be another mental health condition that they are very occupied with a lot of thoughts. Some people think that they are possessed by demons and all that, but it's really not necessarily true. That could be the cause. I mean, many of them, they go see religious gurus here and there, but nothing really. They find nothing, and they come to therapy. They get benefits. So this is just a quick synopsis on some of the causes. What causes the treatment to be taking so long? So we do have a program on like in relationship to the brain. So depression is one thing, and also addiction cessation is also another thing. Because the brain is set and programmed to do certain things, certain behaviors. I mean, lying and gossiping can be something that people cannot let go. They're so happy when they gossip. It's not like they are bad people. It's just that they get a joy out of it. So gossiping, we can be something that we can consider as an addiction or a dependency that we can help people to break through or break away from that. Being on the phones, many times I go to restaurants and I see a family, they're having lunch together or dinner together, but everyone is watching their own phone. And that is by itself, is subconsciously they are so dependent on the phone for information, for happiness, and other things. Gambling, sex, pornography, internet, you name it. All these things are related to addiction, and that can be, people can get treatment. So this workshop is really to help those people with skills that would help them to reduce or treat their addiction or their dependencies on tobacco and alcohol, music, all that, and even spiritual obsession. People might have some kind of obsession on that, and shopping as well as self-harming. So that's just that's a program that we have here regularly. If you're interested, you can go ahead and sign up for relationary.com, register and type in the addiction cessation for the type of the class.